You've tried the behavior charts, the therapy sessions, the medications, but your child is still struggling. The focus isn't there, the emotional outbursts are still happening, and deep down you're wondering, why isn't anything actually working? If you've ever left a doctor's office with more questions than answers, you're definitely not alone. So many parents are handed a quick ADHD label, a prescription, and a pat on the back, only to find themselves right back where they started just a few months later. What's rarely discussed is that over 7 million children in the US have been diagnosed with ADHD, and yet the majority of testing used to make that diagnosis only look at the symptoms. It measures what your child is doing, not why they're doing it. But what if we flip that approach? What if we stopped chasing behaviors and started looking at the system that controls those behaviors? And that's the nervous system. That's exactly what this video is about. So if you're a parent searching for real answers, not just a new medication or management strategies, we want to introduce you to a different way of thinking about ADHD. One that starts with understanding how your child's brain and body are actually wired. So let's start with the two most common patterns we see in practice. So the first one, we call it the raging bull. These are the kids who charge through life at full speed, wide open. Their bodies are always moving, their mouths are always going, and their brains are stuck in fast forward. This is often the type we see in younger children, especially under age 5, who struggle to sit still, control impulses, and slow their racing minds. Then we have the other one. We call this one the drunken bull. Now these kids aren't bouncing off the walls, but they're often completely zoned out. They have a hard time initiating tasks, staying organized, and completing tasks as well. They're easily distracted and often misinterpreted as lazy or as unmotivated. But when in reality, their nervous system is struggling to coordinate and to integrate information properly. Many of the kids that we see have a combined type, so some traits from both of these. And that's where traditional ADHD care tends to fall short. Because the real driver behind these patterns isn't just behavioral, it's neurological. So let's talk about the problem with most ADHD testing. Whether it's checklists, behavioral surveys, or even certain forms of brain mapping, these tools are designed to categorize your child into a subtype. They can label what's going on, but they don't tell you what's causing it. They don't measure the function of the autonomic nervous system. They don't look at stress patterns that may be impairing regulation, coordination, and executive function, and they certainly don't offer a roadmap for restoring balance to the nervous system. That's why we take a different approach. So at E320 Chiropractic, we use Insight neurological scans. These are a set of non-invasive tools designed to measure how efficiently and effectively the body and the brain are communicating. Now, these scans don't just observe behavior, they evaluate the function of the autonomic nervous system. In particular, the sympathetic and the parasympathetic branches. For the raging bull hyperactive types, we generally focus on the total energy index, which should be around 150 or less for optimal function. Now, many of these children test way higher, showing massive nervous system stress. This reflects a nervous system that's constantly stuck in sympathetic overdrive. This is what most people know as fight or flight. These kids are literally wired to be hyperactive because their stress response system is constantly engaged. Now, for the drunken bull type, the issue isn't overstimulation, it's disorganization. Here we look at a pattern score. A healthy nervous system should score close to 100 points on this, showing clear, organized input and output between the brain and the rest of the body. But many of these children score 50 or lower, indicating a lack of efficient sensory integration. That means the brain is receiving distorted information from the body and struggling to make sense of it, resulting in forgetfulness, poor focus, and executive function delays. These scans don't just provide numbers, they give us real objective insight into what's actually happening in your child's nervous system, where the stress is, how severe it is, and then how it's impacting their ability to function in everyday life. And here's where it all comes together. ADHD isn't caused by a lack of discipline, poor parenting, or even a simple chemical imbalance. At its core, it's often rooted in what we call subluxation, or you can think of it as neurological interference caused by misalignment, fixation, and stress within the nervous system. Now, this interference begins early, sometime as early as the womb. We call it the perfect storm. So it starts with prenatal stress and is amplified by birth interventions such as inductions, forceps, vacuum extraction, or C-section deliveries. These early interventions can physically and neurologically impact the developing nervous system, altering how signals are sent and received between the brain and the body. Now, as those stressors accumulate, especially during the critical first few years of life, the nervous system becomes dysregulated. It gets stuck in survival mode, unable to shift gears between high alert and between rest. And the longer that stress pattern stays in place, the more likely it is to show up as what we now call ADHD. But the good news, once you understand the root cause, you can finally start to change the outcomes. The brain and the nervous system are designed to adapt. So because of neuroplasticity, we know change is possible. When we identify the interference, we can begin to unwind it. So if you're a parent who's done all the things and you don't have answers, this may be the missing piece. Insight scans allow us to go deeper, to move past symptom management, and finally understand the neurological patterns driving your child's challenges. And when we understand those patterns, we can begin to change them. If you're ready to stop guessing and finally see what's going on inside your child's brain and body, we'd love to connect with you. Click the link in our bio to learn more about insight scans and how this kind of care could be the turning point that your family has been searching for.